Welcome once again to Physiotherapy Hour with Dr. Umuto Godfrey. Today we are going to look at a topic which I consider very vital and important: stroke. Stroke is vital because it's one major cause of disability globally. Now, we want to look at what is stroke. But before going to the true definition of stroke, I want to take us through some of the myths that people associate with stroke. When we say myths, it means stories or beliefs that people have told over a period of time that appears as if it's true, but they are not really true. Now, what are those myths? One, some people believe that stroke happens only to elderly people. It is not true. It can happen to any age group. Some believe that stroke is only associated with heart problems. It's also not true, but heart conditions can cause stroke. Some believe that stroke is only spiritual, is only caused by spiritual issues. It is also not true. Well, maybe there might be a spiritual input, but the fact that medicine recognizes stroke as a medical condition. Now, some believe that stroke is not preventable. Stroke is preventable. Some believe that taking a lot of vitamins can prevent stroke. It is not true. Some believe that it is hard to recognize stroke, while people believe that once you have stroke, it will lead you to death. It is not always true. Some people can survive stroke, and those are the people we call stroke survivors. So we want to look at what actually is stroke. The World Health Organization defines stroke as a rapidly developing clinical signs of focal or global disturbance of cerebral function with symptoms lasting 24 hours or longer, or leading to death of presumed vascular origin. Now, if you see, look at the diagram there, you see a man with what we call typical hemiplegic gait. A stroke that is not properly managed, the patient will present like this. Unfortunately, some are not even able to recover to this stage, especially when they are mismanaged. Okay, so we want to look at this definition again. One, it is sudden and the occurrence is rapid. When we say the occurrence is rapid, you might find that today, this morning, you were fine. You took your bath, you ate your food, you entered your car and drove to the office, and the moment you got to the office, you discover that you cannot move one part of your body again. And you begin to wonder, what happened? I was okay a few moments ago. Yes, it can happen. Stroke can occur like that. One of my patients had once told me that he was making a phone call when he suddenly discovered that the phone dropped from his hand, his mouth deviated to one side, and he discovered that he could not even lift one part of his body. In fact, another patient was consulting with a doctor, walked into the office of a doctor, and was consulting. The doctor had written his prescription. She was about to get up and discovered that one side of her body was paralyzed. So stroke can occur suddenly at any time. Now, we also said it must last for more than 24 hours. If it is less than 24 hours, it could be a warning sign of stroke. We'll come to that. In fact, that is the one we call usually TIA. There are two conditions that actually mimic stroke. They are usually warning signs. Number one is transient ischemic attack, or TIA. The word transient means it's sudden, is of a very short duration. So in less than 24 hours, it is reversed. And some people always mistaking it. I had a patient that once told me that somebody was sending him stroke, and the native doctor told him, and I had the attack 3 times, and everything was reversed. But at the 4th one, he was on his way to go and meet the native doctor to renew the charm when it became complete, and the native doctor said he didn't come early. You see, those are misconceptions. That is what we call TIA. It can happen. And once it happens, know that you are a candidate of stroke. You must do something about it. So let's look at the occurrence. It has a very high incidence rate. In fact, what I have on the board here is that about 795,000 people experience stroke, whether new attack or recurrent attack. That tells you that if you have had stroke, the tendency to have another one still exist. Now, out of this number, about 610,000 people experience it as a first attack, while about 185,000 are cases of recurrent attack. And on average, every 40 seconds, someone somewhere is experiencing stroke. Now, let's look at the types of stroke. Okay, taking a look at this board, what I have on this board, you'll see certain diagrams. Well, the types of stroke, as you have here, one, you have ischemic stroke, and that covers about 83% of all stroke occurrences. Then you have hemorrhagic stroke, that covers about 17%. And this is vital. This knowledge is vital because I want to bring out something. Most people, they will tell you that their blood pressure was perfectly good. They didn't have blood pressure, or their hypertension is under control. How come they now have stroke? They are going to find out that it's not only hypertension that causes stroke. Now, what is ischemic stroke? When we say ischemic stroke, we are talking of the type of stroke that is caused by a blockage of an artery. Artery supplies blood to the tissues. So when an artery gets blocked by anything, usually in this case, it could be a blood clot, or it could even be pressure. Now, when it is blocked, the blood that is supposed to flow to the other parts of the vessel that is blocked is no longer going to flow. And brain cells cannot survive starvation of oxygen for a long time. So within a short while, the brain cells die and stroke occurs. Your BP might be normal, it might be controlled, but there is a clot. And this is why there is advert. You see it on radio, on television, that once you are 40 years and above, you should commence anticoagulation therapy, usually Vasoprene, 75 milligram daily. The major aim of that is actually to prevent this kind of stroke. Now, the other type of stroke that we're going to look at is the hemorrhagic stroke. Hemorrhagic stroke, from the word hemorrhage, it means there is bleeding. Hemorrhagic stroke occurs when blood vessels in the brain ruptures or begins to leak blood. And factors that are usually related to hemorrhagic stroke are uncontrolled high blood pressure, or over-treatment with anticoagulants, just like I said. Then when there are bulges at weak spots in the blood vessel or aneurysm, or when there is a trauma, kind of maybe a case of accident. Now, I have discussed about what transient ischemic attack. Transient ischemic attack is something that appears like stroke. Suddenly, you lose the capacity to use a part of your body, or sometimes you lose consciousness, but it appears within minutes to 1 hour, everything is resolved. And that's where some people get confused. What just happened to me now? Okay? It is a kind of a warning stroke. Some people classify it as stroke, but the only difference is that it occurs in less than 24 hours. And everything is okay. There's another type which we call RINS, or reversible ischemic neurological deficit syndrome. In that case, it can last for more than hours, but the bottom line is, with or without treatment, you can recover fully. Now, look at some examples of stroke and transient ischemic attack. Okay, this is ischemic stroke. This is hemorrhagic. You can see the diagrams. You can see the object blocking the artery, therefore stopping the flow of blood to the hinder side. You know, the reason is the arteries in the brain are tinier than the normal arteries in the lower limbs or other parts of the body. And because they are tinier, if you have a clot, which could be developing in your calf muscle or any area, once that clot is dislodged and it begins to flow through the arteries, if it gets to an artery that is very thin, that is smaller than the size of the clot itself, then it will cause that blockage. Okay, now let's take a look at something like TIA. You can have a clot that is not very, very solid, and within a short while it is also dissolved. Or as it's flowing through, it causes a blockage, and before you know it, flow allows it to continue. So you now get that kind of attack within a short period, and it continues, and you are reversed because blood flow is reestablished again. So the tissue did not die. There is also another syndrome where people, it is rare, but it's seen mostly in the elderly, where we call multiple infarct syndrome. Multiple infarct syndrome, where the easiest way to find it is when you do a scan in the brain. You will see different areas of infarct, and that's what we call multiple. So it is a sign of repeated attacks of stroke, which could be mild. This person may not have lost any part of the body, but one of the things you find is the person begin to lose memory, the person begin to lose capacity to understand or carry out functions or activities. And this is more common in the very elderly people. Now we're going to look at causes. What are the causes of stroke? Just like I said, just picture it. Two things. Stroke occurs when blood is not being able to supply to a particular brain tissue. And what causes it? Maybe there's a rupture, there's bleeding, or there's a blockage. So what are those things that can cause rupture or blockage? Number one, brain trauma. Okay? Number two, brain tumor. That is growth in the brain. When there's a growth, it takes up space. Tumor takes up space. So it begins to put pressure on the vessel, on the artery, and with that pressure, you of course just get a pipe and press one side. You'll find that water is not able to flow to the other side. That is. Then the other one is arteriovenous malformations, aneurysm, thrombosis, systemic, and all the other things that are seen there, embolism. What are the things that can trigger stroke? If you're an alcoholic, if you are exposed to extreme stress level, if you have some forms of systemic infections, or you have some systemic underlying diseases, you are a pointer to stroke. What are some of the signs and symptoms? One of the things you find, which is most common, is weakness of a particular side of your body. It could be one limb, it could be one side, it could be one hand and one leg. Your face could deviate to one side. Other one is loss of capacity to speak. You are not able to talk, okay? Which is what we call difficulty in speaking, aphasia or dysphasia. That's a medical term. You are not able to speak. So, but you find this most commonly in some type of stroke. For example, stroke that results in inability to use the right side of the body. Most likely, that stroke occurred in the left hemisphere, and that is the area where the speech center is located. So once that speech center is affected, you will lose capacity to speak. Now, you could have vision problem. Even before the occurrence of stroke, you could be having that blurry vision from time to time, and you begin to ask what is happening. Then you could have confusion. You could have headache. Headache is always present, especially in the hypertensive type of stroke. You could have dizziness, and then you could have difficulty in swallowing. Okay, so medically, stroke signs are represented by this acronym, the FAST. And what do we see? You see loss of balance, you have headache, you have dizziness. If you experience these things, please go and see your doctor. You could have eye problem, blurred vision. Okay? You could have facial deviation. You could have weakness of the arm or leg. You could have speech difficulty. And then, when you see all these things, know that it is time to go and see your doctors. Now, what are the risk factors? The question is, does stroke affect everybody? Yes, everybody is prone to the occurrence of stroke, but there are things that makes you predisposed to stroke. If you find that these things are with you, then you know you are a candidate of stroke. and you begin to watch out for it. And you begin to do things that will prevent it. But there are things we call modifiable risk factor and non-modifiable. When you say modifiable, it means things you can change. I'm going to go into them. Now, non-modifiable are things you cannot change. So let's look at the modifiable risk factors. What are those risk factors that you can change? Number one, previous history of transient ischemic attack. If you have had any of those signs and symptoms that we have put there, and you're able to go and see your doctor identify the cause of that, and then treat it, then you have been able to modify that risk factor. If you have high blood pressure, it's a modifiable risk factor. See your doctor and your blood pressure can be controlled. If your cholesterol level is high, see your doctor, it can be managed. And you will be asked to avoid some food, and you'll be given some medications that will help to manage your cholesterol level. If you have heart diseases, atrial fibrillation, diabetes, especially now if you are overweight or obese, you can manage your weight, okay, by reducing your intake of food and engaging in physical activity. Now, what are the non-modifiable risk factors? That's why you find that everyone is a candidate of stroke. Aging, you cannot change your age. As you grow older, your risk for developing stroke increases. In fact, your risk of also developing the factors that predisposes you to stroke also increases. Research has shown that from age 40, people's blood pressure begins to increase, irrespective of other causes. Now, if you have a family history of stroke, know that you are a candidate of stroke, and you can't change that. You can't change the fact that your father has stroke, or your mother has stroke, or your elder brother, your younger sister has stroke. And once you find that in the family, know that you are predisposed. Gender, also you can't change your gender. Then some ethnicity also have been associated with high risk level of stroke. Now, how can we prevent stroke? Okay, you can prevent stroke by one, knowing the warning signs. Just like I'm teaching you now, if you're able to take this lesson seriously and identify those warning signs in your health, and then tackle them immediately. If you take care of your health, obviously you will be able to prevent stroke. If you control your blood pressure, your cholesterol, and your sugar level, you are helping to prevent stroke. If you can quit smoking and limit alcohol consumption, if you eat healthy diet, in fact, there's a diet we call DASH diet, dietary approach to stop hypertension. You can browse it, you will find it there. But it's a diet rich in vegetables and fruits. It's a diet that can help you to maintain adequate level of blood pressure. Then if you stay active and carry out physical exercise, recommended of course, you will be helping yourself to prevent stroke. And then if you know the signs of stroke and act fast, you'll be helping yourself to. Now, how do we diagnose stroke? Number one, a medical doctor, a physiotherapist, a healthcare provider have different ways of making diagnosis of stroke. In fact, the first thing is for us to carry out physical examination on you, and then we'll be able to tell you. But to confirm that you have stroke, sometimes you are requested to do a CT scan or MRI. CT scan is a computerized tomography or magnetic resonance imaging or Doppler ultrasound, and these facilities are available. The advantage of these facilities is that it will tell you where the stroke occurred and probably what caused the stroke. Okay, and that will help in the management. Okay, so we are going to look at how do we treat stroke, how do we manage stroke. If somebody has stroke, is it treatable? Yes, stroke is treatable. The first line of action in managing stroke is to examine the individual. What is the examination going to tell us? It's going to tell us the underlying cause of the stroke. It's going to tell us if there are other underlying sickness that needs attention. Then it's going to tell us the extent of the stroke, and it's going to give us a baseline for comparing with the progress of our management. It's also going to determine the type of treatment that could be given. If, for example, it is caused by diabetes mellitus, obviously diabetes has to be treated. If it is caused by stress, obviously stress management has to come in. Because until the underlying cause is managed, you may not achieve so much success in the stroke management. But basically, after identifying the underlying cause and the patient is stabilized, physiotherapy becomes the mainstay in restoring you to function. What is the aim of physiotherapy? Physiotherapy wants to see how they can maximize the potential that is available and then restore you to independence. Now, for most patients, they may recover fully. When I mean fully, it may not be 100%. Why? Because any brain tissue cell that is damaged is dead. It's not going to regenerate. Of course, there are regeneration in cells of the brain, but research has shown that the cells die almost as they regenerate. But what do physiotherapists do? Physiotherapists identify that there are what we call dormant cells in the brain, cells that are not being used. It's just like backup. Okay, so physiotherapists want to train those cells to take up the function of the cells that are dead. And physiotherapy utilize various forms of modalities and techniques to manage your stroke. Now, where there is muscle weakness or atrophy, physiotherapists want to build up your muscle with various modalities and techniques. Where there is maybe limitation in joint range or contracture, physiotherapists want to improve joint range of motion. Where there is pain, physiotherapy wants to manage the pain. Where there are complications, because some complications can arise following stroke. Arthritis can arise. In fact, one of the commonest complications in stroke is shoulder capsulitis. Before you know it, the patient tells you he's having severe pain in the shoulder, severe pain in the knee. You know, physiotherapists will manage all those complications. Physiotherapists, if you present early, will actually prevent complications from developing. And then, most importantly, physiotherapy wants to reintegrate you back, either to your job or to the society. But physiotherapy wants to make sure within the minimal capacity that you are again independent. Because the cost of independence cannot be overemphasized. If you find that you are depending maybe on your wife, your loved one, your children, you will definitely wear them out. And they can never meet your need the way you would have wanted it. Imagine you want to eat food, you cannot pick up spoon and eat food, and somebody has to feed you through the mouth. You want to go to the bathroom, you cannot get up from your bed, somebody has to come and support you. It means you will make somebody not to go to work, not to go to school, to be with you all the time. So the most important thing in stroke management is prevention. The saying goes that prevention is better than cure. So if you can go through this teaching again over and over, you'll be able to identify the things that I've earlier mentioned on how to prevent stroke. But most importantly, if you see any of these warning signs or you have stroke, please consult your physiotherapist. Thank you very much. If you have questions, you can drop it in the comment section. Thank you for listening.